Welcome to Confabulation, where here we discuss issues related to domestic violence, sex trafficking, victimless crimes, and social advocacy. I'm Zaire, and I'm joined by my co-host Malik.
Thanks, Zaire. In today's episode, we're going to discuss why healthcare is unevenly distributed and how mobile health clinics can potentially make healthcare more accessible.
So let's take a deep dive on the topic. Malik, would you mind sharing with our viewers a summary of what healthcare has to offer?
Yeah, so I guess first talk about this. I think it's important to kind of break down what healthcare or quality healthcare could look like. And I looked through the World Health Organization's page, and they basically said that it's the degree to which health services increase the desired health outcome for a population. So I guess we're interested in understanding how quality healthcare could differ for different groups of people.
Yeah, and why is it important? I would definitely say I feel like quality healthcare is important to everyone, and I have a strong stance that I feel like healthcare should be a human right. It should be free. I don't believe that we should pay for it. Um, and I just feel like it just does a disservice to the people in our country when we have such a huge disparity in healthcare and a lot of people can't receive that quality healthcare that they need. Um, so I guess we can talk about like who is most at risk when it comes to the unevenly distributed healthcare.
Yeah, I think that is also a good place to start. So when looking that up a little bit, we find that of course there are more that are at risk or more affected than others, and basically communities of color, populations with lower socioeconomic status, rural communities, people with cognitive and physical disabilities, um, and even people who identify as LGBTQ are often disproportionately exposed to conditions and environments that negatively affect their health. Um, and that with that, it increases risk of health disparities. So it's pretty interesting how like a country with so much abundance and so much medical technology still have individuals or people in different groups that are at a disadvantage when it comes to access to healthcare.
Yeah, totally. And would you think it has something to do with uh, discrimination or implicit biasness when it comes to those people that are in in the LGBTQ plus when it comes to getting that quality health care, or is it a racial discrimination? Is it cultural barriers that can cause these issues? Um, I just
Mm.
feel like all of this should be out of the window when it comes to the quality of someone's health. We shouldn't look at any of those things, and we should try to do our best to provide the best care to those in need.
Yeah, that is an interesting point that you make, and I think it's a complex issue that we are that's happening in this country. We do know that there are ways that we can address this issue to improve it. One, literacy, I guess, more outreach, allowing helping other people to know um, how they can access quality healthcare, like some resources that are out there. Um, but I think it also comes down to the cost, like cost of health insurance and cost of travel, transportation for people to get access to quality healthcare. So yeah, there's a lot of factors that come into play when it comes to um, who's affected by this.
Yeah, I honestly feel like, with the lack of health insurance giving at most jobs and even people not having that work-life balance, it it
Mhm.
it hinders people from going to the doctor because I mean, I know truck drivers that are only off on Saturdays, and most times doctors' offices aren't open on Saturdays. So it just posts a hindrance on going to the doctor and just putting that time off when you can get your preventative screenings and check on your body a little sooner before chronic illness seems to creep in. Um, I also believe that transportation can be a big thing when it comes to getting that access to healthcare, not having the transportation to get there, especially if you're living in rural areas and you're not living like in a city where there's a bus line um, or a train, and you're very reliant on a car and there's a hospital or a clinic or a doctor's office miles away from your home. I think that plays a huge part. And Malik, you know that I'm a huge advocate for mobile health clinics, and I think that
Mhm.
that should be a solution to some of our unevenly distributed healthcare. So I
Yeah,
just that's where I'm at with that.
yeah, I yeah, I do agree, and it's interesting that you spoke about the example of the driver who works long hours, and that kind of brings up the issue of um, the social determinants that cause these health disparities. So that includes like where we're born, where we work, even where we play. Um, and the systems that shape our conditions of daily life. And
Yeah.
when I say systems, that includes like the policies, the laws that are set in for individuals and for states and areas that people are in. Um,
Yeah.
and furthermore, I guess a lot of the illnesses that many people are facing are preventable. Um, I read there's a Heckler report that came out some time ago. It pretty much details um, or it brings awareness to some of the health disparities that have occurred in the country, and it focuses on people um, of like African Americans and people of other groups. And I found one thing about it that was kind of shocking when I read it. It basically said that, one second. Oh, yeah. So it basically said that, so these preventable diseases like cancer, heart disease, stroke, diabetes, infant mortality, cirrhosis, and homicide, um, they're all preventable illnesses or issues that certain people face more. And I think going back to mobile health clinics and changing policy in our areas, we can find some solutions that could help us in the future um, to like stop the growing health disparities in the country.
Yeah, I totally agree. I think that mobile health clinics is a start to a solution, but at the end of the day, I feel like there is a mistrust and a lack of communication between our healthcare providers and our people. Because we can say quality healthcare is why a huge majority of Black women passing away from having a baby or or giving birth. Why is
Yeah,
that? And why is that the only race that has the largest number of fatalities during birth? What is going wrong? What is not being heard from that person and the doctor? So I just feel like, yeah, we can look at mobile health clinics, and they are great for a solution to help the people in undeserved areas, as well as provide access to care to homeless individuals in urban areas. But we have to talk about the lack of communication that there is between the people and the healthcare providers and the people that have signed an oath to give quality care to those people. I mean, I wouldn't put the blame all on them, but because there is a lack of nurses and a lack of doctors. So I just feel like maybe it's due to burnout. I'm just not sure. And I feel like that's why a lot of people are trying to go a holistic route when it comes to healthcare and taking different herbs or being vegan to prevent these chronic illnesses because we are we are a nation where we have the highest obesity rate. We are a nation
mhm,
where fast food is easily accessible. We are a nation where housing, rent, mortgage, groceries are still going up, but our wages are still the same. Our wages are still not adequate to survive for a living, or to pay your rent, to get quality food or organic food or food from a farmer's market.
Mhm.
So it's just like a catch 22. Um, and that's where I'm at with that. That's my rant.
Yeah, yeah, I definitely hear you, um, and if you even look at the people who live in rural areas, like, who probably have to travel far, or even someone who lives in an urban area where there's a lot of people, a lot of patients in the community hospital, and not enough doctors. There's a doctor shortage, so that I can imagine that putting a lot of stress, a lot of pressure on that one doctor that has to go to a whole bunch of patients. Um, and I wonder what that does to the quality of care that they're receiving compared to maybe a different hospital in a different area that has more doctor to patient, a higher doctor to patient ratio.
I was about to say I definitely see how that could be straining to someone that works in the healthcare field. And I have a lot of friends that are nurses. And when COVID came, it was a lot for them to take on because it was so many nurses and a lot of patients on the same floor. Um, and everyone has their unique needs, and it's hard to please everyone, and you get burnt out and you get frustrated. But I just feel like healthcare is going to be a forever need. And
Yeah,
there should be a push to have more nurses and more doctors, and to get them in a point of view where I feel like you can give care to someone's health, but there has to be a sense of empathy there. Um, there's a lot of nurses that are not the nicest when you come in contact with them, or even like as far as like, this is like an old myth as far as time, but how black people can endure more pain
mhm.
than other counterparts. So I guess that's where the empathy comes from, and going from there.
Yeah, I definitely hear you. Um, and going back to those preventative illnesses that I mentioned before, because we know that high blood pressure, strokes, cancer, they can affect anyone, but what we're seeing that is affecting is like disproportionately affecting African Americans or other minority groups.
Well, Malik, if you have any solutions on how we can prevent those things, let's
Mm.
share it with our viewers.
Yeah, so I know the American Medical Association, they have like a list of proposals that they believe or they stand behind that'll help um, the nation with this issue, and mainly they discuss like policy, changing policy, making insurance more accessible, even to younger people. We know that younger people tend to less young people tend to have less insurance, so we can prioritize having like allowing access to younger people to get health insurance. um, they also discuss increasing the dependent age to 26 for people under 26 to have like health insurance coverage. Also lowering deductibles, that'll be helpful for people who probably are tight on who have a tight budget, who aren't able to afford their healthcare. So lowering the deductible will be able to allow them to access the healthcare without having to bring about that burden of their choosing between their health and and other financial obligations that they may have. Another important thing would be addressing literacy, enhancing the patient provider relationship. I think you did mention that before, and also transportation. Go ahead. What were you saying?
Oh, well, I was just going to share some upcoming events and new resources that
Yeah.
our sister house has to offer. Let's start off with our Media Clubhouse film viewing on June the 13th. We encourage everyone to come out. We will have the link down below. And also, please join our Discord where you will be able to stay more engaged with our programming. That link will be at the bottom, and we hope to see everyone there. Back to you, Malik.
Well, thank you for listening to Confabulation today. We hope that this episode has provided you with a somewhat better understanding of uneven distribution of healthcare and the potential benefits of mobile health clinics. Be sure to tune in next time where we continue to explore important issues. Back to you, Zaire.
And again, we are from Our Sister's House. And if you or anyone you know is experiencing domestic violence, call our hotline at 253-383-4275 or visit our website at oursistershouse.com. Um, this is